All right. We are joined today by the lovely and awesome Tom Burman, or as I like to call him, Tom the Trainer, as always. Certified athletic trainer and currently the director of sports medicine with Plymouth Physical Therapy. And also used to be my personal supplier of BioFreeze in the training room all the time for basketball at Walled Lake Northern. So thank you so much for joining me. I really appreciate you taking the time.
It's a pleasure.
How
Looking
you
for,
been though? Huh?
I've been doing great. It's been crazy. I mean, springtime, as you know, springtime is a busy time of the year. It's a lot of athletes are getting ready, preparing for all the spring sports, and
Mhm.
track and field is always brings out an abundance of athletes. So we were always dealing with overuse injuries and athletes at this time of the year. So it's busy at all high schools, not just ones that I work with.
So is it just mainly high school athletes that you still work with, or do you also have clients that are outside of that age bracket?
We do cover some colleges. We cover some of the Michigan sports teams, the club teams, as well
Mhm.
as some local community colleges as well.
So, so definitely the area of conversation around this series is mindset intervention within youth athlete development. So, kind of to get us um, started off here, one of my main questions is how do you think in throughout the years that you've been working in this profession, how do you think the conversation has really shifted surrounding how vital that mind body connection is within athletes, especially younger athletes?
Well, I wouldn't say that it's shifted. I think there's just a lot more growth into the whole mind body atmosphere with developing athletes.
Mm-hmm.
There's been a transition over the last probably 10 to 15 years where it used to be an athlete would play, one to three sports through their high school or middle school career.
Mm-hmm.
And now we're seeing a trend where with the abundance of club sports that are taking place for all different sports out there,
Mm-hmm.
athletes are specializing a lot in each one sports. I don't approve of that. As a young adult, your body needs abundance of time after a sports season to kind of just recover from the season before you
Mm-hmm.
move on to the next sport and or just a change in sports. And we're seeing athletes, younger athletes these days, and it's getting younger and younger and younger, down even to the very young youth age, where they're playing in sports year round anymore, and that's not a good thing because it leads to overuse injuries, and we're seeing it more and more prevalent now over the past 15 years.
Mm-hmm. So definitely more of that like burnout in a way.
I wouldn't say burnout. It's just completely overuse. I mean, like I said, there used to be a time in the day where you played three sports. You played football in the fall, basketball in the winter, and
Mm-hmm.
track or baseball in the springtime. But now, even with like the abundance of different club teams out there, as I'd mentioned, soccer goes year round for the most part anymore. The girls air guys may or may not play on their club sports team, or they're playing on their high school team, but we find that many are doing some kind of training throughout the year and participation in games. So especially soccer and baseball, we're seeing that quite
Mm-hmm.
heavily.
Yeah, I remember kind of during those high school days with the season and summer camp at Hope College that we would do. I remember having that maybe like small window of time in like that beginning of the year. And I remember my dad mentioning, "Oh, would you be interested in maybe like an AAU kind of thing?" And I'm like, "No." I'm like, I want some free time. I want some downtime to just kind of like relax and not have to think about basketball 24/7. And I know there's kids out there that, they enjoy it that much to where they want to do it all the time. And that's all they want to focus on, especially if there's a reliance for a scholarship in the future. I totally understand that. But I've definitely seen kids just like lose interest because it's either almost like forced upon them by like parents, or it's just total utter exhaustion and almost like boredom in a sense because they're doing it all the time. So,
And it's not even just boredom. It's just I go back to the whole overuse thing.
mhm,
It's not uncommon. I mean, like I said, a kid needs to be a kid, regardless of your age, and you spend 3, 4 months perfecting your craft in high school or doing your best at a sport. And
mhm,
like I said, your body needs time to recover from that. And more now, even especially with the springtime and being baseball with overhead athletes, we're seeing athletes that are sustaining injuries that we used to never see them sustain injuries of the sort, 15, 20 years ago. There's an injury called a Tommy John injury in baseball with throwing athletes, and that's where you tear a
mhm.
ligament in your elbow. And back in the day when I played sports, yeah, I mean, Tommy John was a baseball pitcher in the pros, and that's how it was developed. That he was one of the first ones to ever sustain it, or they identified it.
Hmm.
And more so now, I mean, even one of my best friends, I mean, his son played high school baseball and club sports, and he loves baseball so much. He played year round, and he sustained a Tommy John injury, or he tore that ligament in his elbow, and he had just turned 14. So we're seeing a lot more injuries in youth because of the fact that they're just not taking adequate time off. And some kids do develop a lot faster than others. And if you have the right
Mhm.
combination of things that you're doing, it could be a recipe for disaster in the long run.
Yeah, and that definitely kind of leads into my next question about injuries with, I know especially with high schoolers, we're known to be a little stubborn in a sense. So, uh, my question is, how do you work with or approach those athletes who not quite yet like fully grasp the weight of certain injuries? So, for instance, I know for me with my concussion, that was definitely something I had never experienced or even knew much about.
Sure. Well, when it comes to injuries and getting kids to understand things a little bit more, I mean, obviously, when you're an adolescent, the adolescent brain doesn't fully mature. I think they say to the age of 24, 25. So
Mhm.
one of the things that I've actually, I mean, I started my career in athletic training a little bit differently than most athletic trainers. I went to work after I graduated from college. I went to work for Henry Ford Hospital in downtown Detroit through their Center for Athletic Medicine, and I was exposed to all the pro teams. So I took a leave of absence. I worked with the Detroit Lions for a while, helped out with the Red Wings, was trained for the Detroit Rockers, did Olympics. So I worked with adults a lot initially in professional sports, and it wasn't until I actually met my future wife till I was like, all right, I got to transition. So I was just gone all the time. So if I wanted to actually have a healthy relationship and be married someday, I knew I had to make that transition. So I started working at the high school level. And what I realized in the high school level, working with youth, is that, I could always talk until I'm blue in the face about anything, but the retention that they have when they have an injury or just trying to talk to them is trying to make it simple. That they'll KISS acronym, keep it simple, stupid.
Yeah.
um, I utilize that a lot because, I could, if you came to me and you said, Tom, my shoulder hurts, it's been going on for a few weeks, I'm not sure what to do. I could talk to you, tell you exactly what's going on and educate you and tell you the right things to do. And if I gave you 10 things to do as an adolescent, you probably won't do many of them, if not any of them at all. I mean, it's a lot to give a younger athlete. So what I found was that if I give you 2 or 3 things to do to work on your own, even if I can get you to do 1 or 2 of them,
Mhm.
that's going to be most beneficial for you. That's going to help guide you in the right direction. If I give you too much information, we won't accomplish what we want to.
Yeah.
So I think I focus more on the smaller things, smaller goals initially, and then just try to instill a good work ethic and help the student athlete understand what they need to do.
Yeah, of course. And I think just with those younger athletes too, because I mean, I remember during that time with my concussion and even seeing kids like on the same team as me kind of get like almost like heartbroken in a way where they couldn't, they, it was almost like that routine like just stopped abruptly. And it really, I could see like definitely kind of put almost like a damper in not only the rest of the season, but also with like team cohesion as well. Because, sometimes it's like you get in a rhythm with these other
Hmm.
people on your team, and then it's like when that one person maybe, or like that one puzzle piece, like just is just gone one day. I think it definitely can kind of just mess things up in a way. And it's definitely
Well,
unfortunate.
no, Lorna, you bring up a good point because I think in the younger athlete, whether it's, elementary school or high school, we all have challenges. You as a young athlete, you come to a certain high school and I'm the trainer and I really don't I do my best to get to know parents, but I don't know what things are like in your home. I don't know what kind of things you do outside of the school. I only see you as the athlete that you are for a brief amount of time every single day for 2 or 3 hours. So when you do sustain an injury, one of my jobs as an athletic trainer, I believe it's very important to view to get an athlete of any age to view the setback as a challenge and as an opportunity. So whether it's a concussion or a sprained ankle or whatever, and like you said, you may be an integral part of that puzzle, and now the puzzle piece is missing. Now your teammates have to pick up the pace to try to figure out how to fix that puzzle. But in the meantime, it's my job to help you fix yourself so you can integrate yourself as that puzzle piece back into play. So
Mhm.
I think that having the athlete and injuries necessarily aren't always season ending, but regardless, you still have to deal with a young mindset. It's traumatic at times, and
Mhm.
even just if it's just an ankle sprain versus a concussion or a broken bone, it's devastating depending on the time of the year. It's just devastating to begin with in an adolescent. So trying to get the athlete to have a mindset where they see this as like, all right, it's just a minor setback. We're just going to move forward from here to get ourselves back to 100% and contribute to the team so we can make playoffs or whatnot.
Hmm. Do you
Hopefully that helps.
often, do you ever kind of, maybe, I'm not sure if this is true or not, but do you feel that sometimes athletes are maybe more comfortable going to you as like a third party instead of maybe like a coach or a parent to talk about struggles that they're having, whether that's with the specific injury or just stuff that's going on like outside or within the team?
You know what? I've seen it all. I mean, it's every case and every athlete and every injury or whatever developmental thing is going on in their life. If they come to me, I try to be, at times I'm not just the trainer, I'm the doctor, I'm the psychiatrist, I'm the psychologist, I'm the stepdad, stepmom, whatever you want to call me. I'd always willing
Mm,
to bend an ear. Because like I said, I don't know what's going on in most kids' homes. I don't know what's going on in their, outside of school or with their friends. So it's just lending an ear and hearing them out to actually, help them, guide them in the right path. And more times than not, I mean, I'll give a good example. Last night I was at a soccer game. We have so many schools and colleges that we cover, but I was at a soccer game. It was cold as heck out, and I ran into the concession area just to kind of warm up for a little bit at halftime. And I
mhm,
walk out and I see a parent whose two older sons had graduated from a school many years ago, but I didn't even realize that they had a younger daughter and she was playing in the soccer game. And his two older sons were a handful. They were great athletes, very hardworking kids, but they just their mindset on failure was horrible. So trying to work with athletes that have such a hard work ethic, such a desire to win, but I hate to say the word mental midgets, but they couldn't deal with loss very effectively at all. And they
mm,
would have tantrums and they would punch the walls when they would lose and they'd get in fights with their teammates. So I mean, that situation and running into that dad last night, and he brought back some things and he apologized for a few things, and which he shouldn't have, because like I said, every young athlete is different. And I dealt with both his older boys a little bit differently. Um,
mhm,
one was one was tougher to work with than the other, and now they're both successful businessmen, and they're in their 30s, but it was a challenging time for them. And like I said, who knows what goes on at home? Who knows what goes
mhm.
on outside the school? What we can only do is try to work with what we have in the confines of our team. And Some things worked and some things didn't, but we had to try. And in the long run, everything that we did turned out to work really well. And
Mhm.
the athletes did really well throughout their high school career. But they grew into it. They learned from their failure. And I think that's one of the biggest things too, is that you have to fail. Athletes
Mhm.
have to fail, whether it's they're failing in a game or they're failing with a rough week or they're failing in their tests or they're failing in their games or whatnot. But this helps you kind of cope and look at your life in a sense and say, all right, this is some of the things I need to work on. Whether I'm an athlete or a student, all right, I really need to get down to the grindstone. And I was always an athletic trainer. Times have changed so much over the years where when I was younger, I'd have friends that would go into the gym at the local high school and shoot baskets in the dark and all that kind of
Mhm.
stuff. And now they lock up the schools all the time and it's hard for kids to get in when there's nothing
Yeah.
else to do. And I was always that trainer when I was in the high school setting. If the kid came in and wanted to work out and there was nobody else around, I would sit with him in the weight room and work out, let him work out so that way he can get his reps in, or even just like shooting baskets in the dark. I would be the guy that would turn on the lights for him and sit and watch them. So, like I said, it goes back to not knowing exactly what's going on in their world outside of athletics, but I think it's important for kids that want to succeed to fail, and then also to realize, all right, I need to put in the extra effort to do better and whatever it is that I want to do.
Yeah, and I think that's so important too, just kind of like looking back on those times in high school and just like the younger kind of athletic days as well is like you always needed that at least that one person that would just kind of like you said like keep the lights on for you during like times like that.
Sure.
And I think that in of itself is just one of the most important things for this younger generation is keeping that light on. So thank you for that.
Oh,
And so one of the other questions I have definitely deals with burnout in athletes because with mental or physical exhaustion can definitely increase that risk of injury. So my question for you is, have you ever had a scenario where you had to kind of be like that voice of reason and step up for an athlete to maybe a coach or a parent and be like, hey, something needs to change because yeah.
yeah. There's so many stories that I could share. It would take us days to go through. And like I said, every athlete,
I'm sure.
it's funny. I run into athletes all the time, and it's like if I run into you somewhere, I'm like, oh my God, Lauren Warner, you had a
Yeah.
concussion on your freshman year, sophomore year, and I do that all the time. I run into people. Actually, I just had uh, one of my first years. He's probably 33 years old now. One of my first years at one of the schools I was at. He ruptured his Achilles tendon,
Oh.
and I've treated his parents off and on over the years, but he ruptured his Achilles tendon about 3 months ago, and it was 10:30 at night. He called my phone, and kind of woke me up, and I was
Mhm.
like, "Hello." He's like, "Hey, it's so and so." Like, "Hey, what's going on?" He's like, he had a sense of urgency. He's like, "I
Mhm.
really need your help. I just ruptured my Achilles tendon." I said, "Holy crap, where are you?" He goes, "I'm laying on the basketball court. I told my teammate to go get my phone to call you because I didn't know what to do." So I mean, looking back, I mean, I'm proud that I made the contacts with the athletes like that they can call me even after the fact or so far removed from high school that they trust me enough to get support. But I think it's really important for the athletes to have somebody that they can go to and lend an ear. Just whether it's not even just over an overuse injury, but I think interjecting with an athlete that is having problems, and you mentioned burnout. Um, one of the things is just being, as an athletic trainer, not only do we have to be tied in with our athlete, we have to really be tied in with our coach and having
Mhm.
constant communication with our coaches to find out if I mean, your coach is with you for hours every day, and I might just be in there for a glimpse of that, but he's watching a lot of things that are going on and can come to me and say, hey, I think this might be happening with athlete X, Y, and Z, and that
Hmm.
prompts a further evaluation. But I also think that it's important for your parents to be involved in it as well, 110%, because let's face it, young not just that young athletes, but young people in general sometimes have a hard time communicating with their parents, or they're not willing to share a lot of information with their parents. And it
Hmm.
wouldn't be uncommon for me to have an athlete come to me and say, hey, my knee's been hurting me. Tell me what's going on. I'm like, how long's it been hurting you? 4 months. Okay, well, where you been the last 4 months? Well, I didn't want to see anything. It started with last soccer season, and then I kind of did some play basketball in the summer. I didn't want to sound like I was being weak, and I just played through the pain. And I
Hmm.
hear that story over and over and over again, and that's where it really comes down to education and educating the athletes before the season. And some everybody's mentality is a little bit different. Some kids get it right off the bat. Some kids are a little bit more stubborn and have to be educated over and over again. But I
Hmm.
think it's important to have parents on board, let them know what's going on they have to know what's going on with their young athlete. So that way, if once we design a plan to get you back into play, the parents can actually monitor at home. Hey, little Billy, have you been doing those three exercises that Tom gave you? Yes, no, or it's not helping or whatever. And then they call me, their voice of reason. They call me and say, Tom, he or she says they're trying to do it, it's not working, what's the next step? So then I
Hmm.
reassess the athlete and change things up a bit. So I think when we mention team or team approach, it is a team approach. I never want an athlete to feel like they're on an island by themselves.
Hmm.
And I think that you have to focus the praise on the athlete when they do succeed, but also kind of give them a little nudge when they're not doing the things that they're supposed to do. And
Yeah.
we do see that a lot. And the youth sports. It's much more different than the professional sports. And professional sports, what I saw was that we had to basically physically restrain people from getting in the weight room or getting in trying to do too much because the intensity level and so much is riding on it at that level.
Hmm.
But in the youth sports, I think it's important everybody works as a team and as one functional unit.
Hmm. And that's so interesting too, because I feel like with burnout, and I know how you were kind of talking earlier about just over usage and everything is a little different. So what are some things that you kind of look for in order to really differentiate between just normal fatigue and burnout in an athlete? Because I know there's like, I remember a couple of days where it's like I just had a few bad days with just being so busy with tests and school, and I was just exhausted. And then
Mm.
actual points in my life during the season where I was like, I just don't feel like I can do this anymore.
Sure. You know what? I think that's where we go back into the team approach again. Just I mean, having the coach and the parents and any but the athlete's teammates being a voice of reason to help get a better bearing. But if an athlete comes to see me early on in the season and
Hmm.
they're developing overuse injuries very quickly, and then you do a little history on them and find out how long it's been going on or what the situation is. Like I said, everything comes down. If you ask the right questions to anybody, they're going to kind of tell you what's wrong with them and what's going on. But I think it's important to identify it early on. Like I said, all too often I've had athletes come to me and they're starting a season, but they're already in burnout mode because they've been playing year round. And
Hmm.
so that's where, I mean, inevitably something's going to break. Something in their body's going to break down. And that's when you actually have to pull the reins back and it can be tough. I mean, it's really tough on the athlete when you tell them you got to shut them down. It's tough on the
Hmm.
coach and their teammates and parents. And the other thing is too, is parents are a lot more different now than back when I was younger. They're a lot more hands-on. I shouldn't say that. It was just my experience.
Hmm.
Parents are a lot more want to be a lot more hands-on now and find out what everything is going on with their student athletes um uh work ethic and whatnot. But I think what it comes down to is making sure that the parents are understanding that due to the nature of what they've been doing for so long, it's gotten to the point where they can actually hurt themselves significantly. And then that's such as the case, like I said, with like a Bankart lesion in the shoulder from throwing too much, or Tommy John injury in the elbow. I mean, there's signs along the way that you need to keep an eye out for. And a good coach and parents and the trainer should recognize those earlier on so that way they can make the proper adjustments to the athlete's um, season.
Yeah. And
Hopefully that was the right answer.
no, I totally agree just because I mean, I think it was interesting what you said about how parents are definitely different a little bit nowadays because I think kind of like I hate to say back then, it makes me sound so old, but but I think that definitely that notion of like when does it need to be like tough love and then when does it need to be like all right like I actually need you to kind of like back off because it's not helping in any way. I definitely had
Yeah,
to have the that conversation with my parents, more so my dad, with injuries and basketball and whatnot because it's like I don't want to come home and hear about all
yeah,
the things that I did or didn't do. I'm like, it's
yeah,
over. I already gave myself enough, excuse my language, shit as it was.
yeah.
So, yeah.
I
But,
get it. And you know what? I mean, as a parent, we always mean well. And as an
mhm,
athletic trainer with a daughter that was a gymnast and a very good gymnast at that, I mean, I don't have all the answers. You know, I could give all the best advice as I can as a dad, but I'm just dad. I'm not the athlete. I'm not my daughter's per se athletic trainer.
mhm.
And I'll give you a couple of examples where I almost felt like I failed as a parent and as an athletic trainer, and it hurts to think about it. But I mean, when my daughter was going through gymnastics and gymnasts, I mean, she was going doing it kind of year round almost. I mean, she had the breaks like we should, but
That's hard
gymnastics
on the
is very
body. Yeah.
yeah, it's very tough on the body, and yeah, I mean they're very in tune with what's going on with their body, and when doesn't seem right, they got to pay attention to it. And she came to me on two separate occasions. One time her heels were bothering her, and she was at that age. She was going through a growth spurt as well,
Mhm.
so she was really really tight. We had her back off on some of the stuff that she was doing in the gym at training. And I told her, I said, all right, you need to do these stretching exercises. You need to do these other exercises for your hip and your lower extremity. And every time I turn around, I'd say, hey, did you do your exercise today? Well, yeah. I'm like, well, I can tell you didn't because you just the way you answered me. She's like, well, you don't know what I do in my room and this and that. And
Oh
and
my
so
goodness.
this kind of led on, and I just knew that she wasn't doing the things that she was supposed to be doing. And she's like, I want to go see the doctor. And I said, well, I'm not going to take you to the doctor until I want to see some effort out of you to try to get better. She
Hmm.
wasn't icing it. I know she wasn't icing it. She wasn't doing her stretches and she wasn't doing her exercise. So this went on for a period of time. And then she came to me and she's like, Dad, I was at practice and God, my heels hurt so bad. And this had gone on for a couple months. And I said, all right, enough's enough. And I was a little frustrated because I knew she wasn't doing the things she wanted to do. And I called up my friend that's a female orthopedic surgeon that specializes in women's sports. And
Hmm.
I told her the scenario, what was going on. And she was, well, let's just have her come in. I'll talk to her and we'll get some x-rays. And sure as heck, she took some x-rays and she had stress fractures in her calcaneus in both heels from the repetitive pounding.
Yeah.
And it had probably occurred because all the repetitiveness, and I didn't say, all right, we need to back you off. And she wasn't doing the things she was supposed to be doing. And it was one of those things where I was kind of, she used to call me the suck it up dad because I was always tell her to suck it up.
Yeah.
And here I am giving out advice to all these athletes and I'm telling my daughter to suck it up. But
Yeah.
I wanted her to recognize that she had something going on. She needed to do certain things to help herself and she wasn't doing it. And so
Mhm.
I wanted her to have some stake in the game. And so little did I know what was brewing was some stress fracture in her calcaneus. So I
Mhm.
dealt with that. And then she decided while she was doing gymnastics that she wanted to do cross country. And she had never run much more than 100 yards in her life with gymnastics. And now she's doing miles at a time. And she was
Mhm.
complaining of hip pain. And so I evaluated her and she had a lot of hip tightness and hips were off a little bit, and we did some treatments. I gave her all the things again, what she needed to do, and she wasn't doing any of them. And
Mhm.
at that point in time, I wanted her to get her formal physical therapy and she didn't want to go. And I just set up an appointment and she wanted to go to the doctor. And I said, well, you know what? I'm not gonna get busted twice on doing something wrong. So we went to the doctor and sure as heck, she had stress fractures in her hip. So, I mean, I had all the best intentions to help my daughter. And so
Mhm.
now we say I'm 0 for 2. But the thing is like I learned a huge lesson to obviously listen a little bit more attentively, but she also learned a lesson as well that, she has to have some stake in the game and she has to be cognizant of an adult who's trying to
Mhm.
help her, give her some advice and to do the right thing so she doesn't develop an overuse injury.
Yeah.
So
Well,
I'm 0 2, Lauren. I need some
that's all
help.
right. Hey, we learn. We live and we learn.
That's right.
But speaking of advice, what can you think of or just kind of like pops up in your head as maybe one piece of friendly advice you would give for athletic trainers, physical trainers, just kind of like starting out?
I would say put in your time and be the biggest sponge you can be. Um, I don't see that in my profession as much anymore.
Mhm.
Like I said, times have changed. So when I got out of college, I wanted to learn as much as I could. So
Mhm.
I had the right scenario when I went to work for Henry Ford Hospital because, like I said, I worked in the clinic. I helped work at a high school. I worked with all the different pro teams. I also worked as a physician extender in two of the top Midwest orthopedic surgeons practices. So I learned a ton and
Mhm.
I wanted to be the best representative as an athletic trainer I could be. And the continuing education never ends. I mean, just when you think you kind of know everything, there's a new technique that pops up or a new evaluation, special test or whatever. So I always wanted to better myself. So I think
Yeah,
that's important I mean, not just being an athletic trainer. I think being the best individual in life in
yeah,
any endeavor to educate yourself the best possible and continue to learn and ask questions.
yeah. You're never too old to learn, that's for sure.
That's right.
But well, to wrap this up, I do have one last question, and this question is revolves a little bit more around the name that I gave this series being called Peak Conversations. And I named it that because I feel like the peak or the summit of something can be very symbolic in the journey of just achieving something, especially in sports and in life. So my question for you is, what is a peak moment or gratifying feeling in your career that kind of like keeps you going?
What do you mean? Like, what was the pinnacle? Like, where I'm like, all right, I'm gonna do the best that I can in this profession, or throughout my career, or something just right now, currently in my life.
Just something that I think keeps you aspired to, like you were saying, like keep learning, keep going.
Um, well, now, I mean, I'm in a different phase in my life and my career than I was in my 20s and 30s. I mean, now I have a lot of athletic trainers who report to me,
Hmm.
and I think it's important for me to convey all my past experiences with them so they have an understanding of what I went through, what I encountered. And if they can just walk away with a few tidbits of information, if I help them learn through a situation, and it's not uncommon at all for one of my staff to call me and say, hey, I'm having trouble with this athlete doing with this injury. What do you think the next step should be? Or, hey, I'm having trouble communicating with a parent because their kid won't do this, or the parent wouldn't listen. And so I guess I'm almost kind of like a fatherly figure, but a mentor as well. So that's a different stage in my life right now that it actually took a while for me to grasp because I was kind of a solo kind of guy and I love to do things on my own.
Hmm.
But I do find it really rewarding to be able to help my staff and help guide them in the right direction. And they call me about, I mean, I just had one of my athletic trainers call me the other day about um, car insurance.
Oh,
She
yeah.
didn't know. She's like, hey,
It could
what
be
do I do about
confusing.
this? Or how do I get a good quote and this and that? And so that,
Funny.
I'm open to anything, but when it comes to just our profession, it's just being open-minded, guiding trainers in the right direction, and helping to educate them because it's a long, I've had a long career, and it's a
Hmm.
very demanding career. And even in the professional ranks, I used to say I would get to the stadium before the sun rose up, and I'd leave after. So I mean, it
Hmm.
wasn't uncommon to get to the stadium at 5:30 in the morning and leave at 11 or 12 at night. So, as an athletic trainer in the high school setting,
Yeah.
it's not uncommon to get there at noon or 1 and not leave until 10 or 11 at night as well. So, um, it's been a great career, but like I said, it's time for me to just educate the newbies coming up and help guide them in the right direction.
Well, thank you so much for taking the time to answer all these questions of mine. Um, Again, I hope
No, I'm glad
everything
we
is
connected with
going
you.
well. I can't tell you how much I appreciate the time. So thank you.
No, you're very welcome. Feel free to reach out to me for anything, Lauren.
Perfect. Thank you
And
so
good luck
much.
with your studies. Be in
Thank
touch.
you.